Welcome. Consider the scenario. You have a patient with worsening renal function in the hospital. You need to call a consultant. So what do you do next? First, be prepared with the name of the patient, the location of the patient ID number or medical record number, the person calling the consult if you're not the person themselves, and the contact number to call you or the person calling the consultant back. The next thing to do is to consider calling early. Early is important as it gives the consultant time to triage their patients, decide who to see first, or finish up whatever work they're doing to get to your patient as soon as they can, depending on the level of urgency. The next thing to do is to summarize the patient's hospitalization over the last few days in 1 or 2 sentences. The next thing you want to do is pose a question. For example, does the patient require dialysis? Does the patient need surgery? How do we dose the antibiotics? Because these are some of the questions that will help target and specify the kind of help you need, and you will get that help. If you do not specify the question, you may get the consultant focusing on another issue with the patient. The next thing to do is to convey your level of urgency. So if the patient needs to be seen immediately, or they can be seen the next day or within the next few hours, the level of urgency needs to be conveyed to the consultant. And before finishing off the conversation, just make sure you clarify their understanding and ask them whether they have any further questions as well for them to ask you before you put the phone down. Thank you.